Exercising to lower your blood pressure. It's not the workouts that you choose, but how you go about them. Hypertension affects more than half of America's adult population. It is a leading cause of stroke and heart attack, and often comes with no obvious early symptoms. One of the best ways to both prevent the high blood pressure and lower it is by working out, as well as an improved diet. That's in part because inconsistent and frequent exercise prompts your body to form new capillaries. It's like producing extra release valves for your heart, said John, the education content director for the International Sports Sciences Association. So there's less of the pressure on the existing blood vessels. But which exercises are the most effective? Numerous studies have found that yoga, wall sit, and the cardiovascular exercise are particularly helpful for lowering blood pressure. Tai Chi is another gentle, low-stress exercise that some studies suggest is especially good for hypertension. Any exercise will help, but it's the framework you put around it that matters most, said Dr. Lilly, the director of sports cardiology and an associate professor of medicine at Johns Hopkins University. The framework should follow a few rules around the things like the intensity, regularity, and effective warm-up, and include regular consultations with your doctor. Blood pressure spikes can cause health emergencies, though other effects are more subtle. If at any point you feel lightheaded or dizzy, stop immediately and check in with the healthcare provider. Do's and don'ts. If you are dealing with elevated blood pressure and you are new to exercise or out of practice, take a longer warm-up than you might otherwise. Mr. B said, spend at least 10 minutes at that lower intensity, aiming for a perceived exertion level of about 3 out of 10. If you go right from resting to working, you will have a bigger spike in heart rate and also blood pressure, he said. But don't be afraid to get your heart rate up once you are ready, unless you have severely elevated blood pressure. It's okay for a vigorous walk. For instance, Dr. B said that could also mean walking faster, hiking on a trail, or carrying weight.